last year, the Surgeon General warned the country about a loneliness epidemic. There's a new study that suggests there's a link between living alone and higher rates of depression. Joining us now is Sharonda Brown from S. Brown Counseling. We're going to have a conversation about this study and some of the reasons behind those numbers. Sharonda, thank you for being here with us. What do you think is driving those factors that they're seeing here?
Hey, Terrence, thanks for having me. I think human interaction is very important for humans. And I think part of it is when you're not interacting with people, you're not growing, you're not stimulating, and you're starting to create this narrative in your head about why that is. So let's say you're telling yourself that you're not interacting with people because you're not good enough, or no one loves you, or no one cares. That's going to create a system that increases stress. And that stress is ultimately what leads to depression. Being able to interact with people gives you new insight, new ideas, and the brain loves new information and it loves that interaction. So when you're depriving yourself of that and you start telling yourself negative stories, it can definitely impact your ability to have good mental health.
Interesting. And we see here with the study, it looked at groups 45 to 64, found a major disparity there, showing that they were more likely to experience those feelings if they are older and living alone. Can you speak to the importance of making sure that you're visiting people, checking in?
I think it's important to visit people, especially your elders, especially your parents, partly because a lot of times when people get older, so we see this all the time with geriatrics. I see it all the time with clients who come to see me and they're older. They're forgotten about on some level. People start living their lives and they think, okay, well, no news is good news, so I don't have to check on them. And then they jump into crisis mode when they find that their elderly or their loved one is now sick or something's going on. And I think similarly for the elderly or those who are in that range, because I don't think 45 to 64 is elderly at all. But I do think that these are the parents who live for their children. And when they become older and they realize their children start to have their own lives, they forget who they are outside of that role of parenting. So they haven't developed friendships, they haven't poured into each other. Even if they're married, they haven't spent time dating. So that contributes a lot to that loneliness as well, because they haven't lived for themselves. They found themselves living for those roles that they play. So I think it's important too to find things to do, find activities. You can't live for your children. Your children will grow up and they will have their own lives, and you'll find yourself being alone and not knowing what to do without having someone to care for. So care for yourself. That way you have a network of friends, you volunteer, or maybe you find yourself dating your spouse all over again. And I think it's important to recognize what impact that will have on you if you don't engage in caring for yourself earlier than later.
There's a lot of people who really were forced into that experience during the pandemic when really we had no choice but to be alone in a lot of cases. Do you think that that was an awakening for a lot of people of what some people deal with all the time?
Absolutely. You have some people who are extrinsically motivated where they don't know what to do without something going on the outside. And when people are stuck to sit with themselves, they're forced to see who they really are, what they like, what they don't like. They're stuck with those thoughts that they have of themselves. And it becomes overwhelming sometimes, almost unbearable. I definitely saw a hike in sessions during that time because people just did not know what to do with themselves. And they were forced to be around people sometimes that they never had to be around before because they were stuck in the house. So they learned a lot. Some people liked what they learned, other people did not. So I definitely think that that contributes a great deal to depression, is that shock of realizing that things are not always what you think they are, and some escapes you can't always get to. So what do you do when that happens?
Now, you mentioned a few things that people can do to try to make things better. Are there other things that people can try to incorporate into their lives so that they don't have this experience?
I think it's important to think about who you want to be once your children are grown or once you are in your 40s and 60s. I know it's easy to say what it is when you're seeing it in the moment, but sometimes I think it's important to find activities, find groups, think about what you want to do, find hobbies. I mean, do you want to crochet? Do you want to do a dance? Do you want to, be a part of traveling groups or, movies? That there are a lot of things to do, but I think sometimes people struggle with a lot of social anxiety in which they don't know how to interact with other people, and so they'd rather be alone. So it's like they're working against themselves. Like they want to be around people, but they don't want to be awkward when they're around people. So they choose to just be by themselves. So deal with that social anxiety, deal with the messages you're telling yourself about why you're by yourself or why you don't think you need to be around people. And I think that the minute you start to get out of that and start spending time by yourself now, then you won't find yourself being lonely, because loneliness is a state of mind. It's not something that happens because you're in a room alone. It happens because of what you're telling yourself about why you're alone.
All right, and of course, if you feel the need, you can reach out to someone, like you, right? And get that help if needed.
Absolutely.
All right. We appreciate it.
Absolutely. I think it's important to build that support system. Call people, say, hey, how you doing? Check in. I think sometimes people think that they're bothering others by just saying, hey, I need you. Can we just have coffee? Or I want to come sit with you. And I think it's important to get out of that mindset and just call people and say, hey, I want to have company. I want to come sit with you.
Yeah. Start the conversation now. Sharonda Brown
Yes.
from S. Brown Counseling, thank you for joining us. Thank you for your expertise. We appreciate it.
You're welcome. Thanks for having me.